Okay, so there's a lot of trends in this industry. I found over the last however many years, something will be in and then it'll be out, and then something else will be in, and everyone's jumping on that trend. There's a big one right now where people are wanting natural results. They come in and they just want to look natural. What does that mean?
Well, we have to define what natural means because that term's also used as a way um, to market a person. So people do use that as just one of these terms that doesn't have a lot of meaning and is just meant to market themselves in a way that resonates with people. So if we're honest and we say, what does natural mean? Then that's different than what you see it means on social media. Because a lot of what you see on social media is not natural results.
And in all honesty, none of it is natural. Like, I don't have wrinkles. I'm a 47-year-old white woman that used to bake in the sun. I don't have wrinkles because I do Botox. That's not natural.
Yeah.
I don't have tons of pigment and sun damage. My skin's pretty good. That's because I do lasers. None of this is natural, but I don't think I am probably, if there was an award for the most under-injected nurse injector, I would get it. I don't have a lot of filler in my face, but it's not natural.
And most people who look at practitioners wouldn't think they look natural. I mean, you're beautiful and your results are very, very stunning and subtle, but most practitioners out there do not stay subtle. And I think that's probably a better term is subtle as opposed to natural.
That's fair.
Because really, what does natural mean? I mean, it doesn't have like a real meaning. Subtle is more meaningful to me because when we think of subtle, we think that we want results on people that when they're looked at, nobody can identify what they've had done. I always say this to my patients. You don't want to have something done to your face where someone can look across the room and pick you out and figure out what you've had done.
Yeah.
That's not subtle, and
You're right.
and it's the opposite of natural.
Yeah, maybe it isn't. Maybe we should be calling it subtle results instead of natural, because you're absolutely right. It's those people that have taken it too far and gone next level that you look at their faces and you think they're starting to not look natural or not look human. Some of these people don't even look human. They just, and I don't mean that in a bad way. I would never criticize anybody. I wouldn't want
'cause
someone
that's
to
a good thing.
criticize me. But I think you're right. I think subtle is exactly what we're trying to sort of pinpoint when we're talking about helping our patients have natural looking results.
Yeah, stay subtle and also stay balanced. Treat multiple areas of your face, and that maintains a balance so that one area is not disproportionately changing compared to the others, and that includes skin. So if you really want to stay natural, you've got to treat your skin along with everything else, because that's also a discrepancy when people don't treat their skin but they add filler to their face, then
Yeah.
there's a discrepancy.
Or you're right in sort of talking about the balancing. Like, patients will come in, I think that's part of our job as a provider. They'll come in and say, I want lip filler, I want lip filler, I want lip filler. All of a sudden their lips aren't matching the rest of their face when maybe what they needed was a little bit of cheek because they've lost some volume there, maybe a little bit of chin because their bone's starting to recede there. But they think it's just lips, and I think it's kind of up to us to help keep that natural balance in their face so they do look subtle or natural.
Yeah, I think it's exactly right. Subtle and balanced.
Yeah, I like it. It's good. That's how we're gonna all stay. That's how we're gonna keep all of our patients subtle and balanced.